Labral tears of the shoulder. It is the most commonly diagnosed problem by radiologists in the average MRI. And one of my favorite slides from any meeting I've ever been to was a slide where the title was Scans on Pain-Free People. And it showed the results of studies that took people off the street with no symptoms and showed how many times the radiologist would say they had tears. Well, and there are 2 studies on this in the shoulder in patients over 40. And in one study, 50% of the time, the radiologist said the patient had a labral tear, and in the other one, it was 70% of the time. So the starting point with labral tears is that they're very, very commonly seen as a tear, on an MRI, when in fact it may not be that big a deal. It may just be a little bitty cleft or something in the labrum and not clinically significant. So you get back to this concept that you treat the athlete or you treat the patient, not just the MRI. And just because the radiologist thinks you have a labral tear does not necessarily mean you need surgery. That's a very, very important concept. Now, if your shoulder's unstable or you have mechanical popping, totally different. You might need surgery. But a lot of scans show a small labral tear. And so I think patients, you have to merge that with exam, the history, and all, the findings on the scan. But if you do need surgery for a labral tear, then it's almost always arthroscopic, where we have great techniques for repairing the labrum. It can be for different reasons. Sometimes the labrum just is popping and is trimmed. What the labrum is basically a cartilage bumper around the socket. The shoulder is not a deep ball and socket like the hip is. Hip is more like a ball in a cup. Shoulder's more like a golf ball sitting on a tee. It's inherently unstable. Lots of motion, lots of play back and forth. Well, the labrum would be like a little rubber bumper around the edge of the tee. And so the ball, but from the ball going back and forth, sliding over it, you can tear your labrum. A lot of times it's a little mobile anyway. Sometimes you might tear a flap of it and need it trimmed. Other times you might really detach the labrum and the shoulder becomes unstable, where it can dislocate, or sublux, where it's just kind of sliding partway out. And we have good arthroscopic ways of repairing that. In terms of preparing for surgery, for labral surgery, I don't really think there's a whole lot that you would do specifically for preparing for labral surgery, other than just the normal steps of preparing for surgery with hygiene and antimicrobial type soaps before surgery.